I would like to introduce to you Dr. Elizabeth Partin, DNP, APRN, has served in a number of nursing leadership roles. Some of those include the Kentucky Board of Nursing, President of the Kentucky Coalition of Nurse Practitioners and Nurse Midwives, KCNP&M Legislative Liaison, and current KCNP&M Vice President and Chair of the Legislative Committee. She also serves as the current chair of the Medicaid Advisory Committee, which advises the Kentucky Department of Medicaid Services on the administration and operation of the Medical Assistance Program. Dr. Partin has served in a leadership role for over 20 years, helping to enact legislation and regulations that will improve health care for all Kentuckians. Dr. Partin served on the editorial advisory board and is editor and writer for the Advocacy and Practice column for the Nurse Practitioner Journal from 2005 to 2009. For her advocacy work for patients in the nursing profession, Dr. Partin has been awarded the University of Louisville School of Nursing Top 40 Outstanding Alumni in 2014, University of Louisville Alumni Fellow for the School of Nursing, House of the Commonwealth of Kentucky Honors Proclamation for Outstanding Service, the American Association of Nurse Practitioners State Award for Excellence, and the NP Advocate of the Year, Kentucky Nurses Association Distinguished Nurse of the Year, Kentucky Nursing Excellence Award, Senate of the Commonwealth of Kentucky Honors Proclamation for Outstanding Service, and the American Academy of Nurse Practitioners, Kentucky NP of the Year. Dr. Partin owns her own practice and provides primary care to residents in Adair and surrounding counties. She serves as a clinical preceptor for nurse practitioner students from Western Kentucky University and Frontier School of Nursing and Midwifery. She has dedicated her career to providing health care to those who live in the medically underserved area of the state and to the profession of nursing, which she holds so dear. Would you please welcome Dr. Beth Partin.
Sound impressive, but I'll tell you, I'm just Beth, so. Okay, so we're going to talk about navigating the political process and how to make positive inroads doing that navigation. How do you go from an idea to actually having a bill passed? And the picture up there, I don't know how well y'all can see it from my angle, it's kind of fuzzy, but that is the governor signing Senate Bill 7 this year, which was a bill that removed the requirement for APRNs to have prescribing agreement for non-scheduled drugs. And that was quite a fight, and so this picture is pretty special. So, in order to go from an idea to an actual passage of a bill, we need to understand the process. And the first part of that process is understanding the difference between regulation and statute. Both regulations and statute are laws. However, regulations are used to further clarify a statute. So, for instance, a regulation can't change a statute. One might say, why didn't the Board of Nursing just enact a regulation that said that APRNs can prescribe medication way back in the 90s? Because the actual nursing statute doesn't preclude that. However, the pharmacy laws and other statutes prevented that, and so therefore a regulation couldn't be enacted to override a statute. So, again, the regulations clarify a statute but cannot change a statute. Regulations are an easier process. Regulations are promulgated by state agencies. So therefore, when you're working to amend or enact a regulation, you're working with one agency and not the whole state legislature and all that comes involved with that. And also, passage of a regulation doesn't require the approval of the full legislature, although there is required approval from legislative committees. A legislative committee cannot stop a regulation. However, if the committee doesn't approve the regulation, then that regulation will have to go before the full legislature at the next scheduled legislative session. Statutes, on the other hand, are a complex process towards passage. It requires full approval of both the House and the Senate, and must be sponsored by a legislator. And they can either be a representative or a senator. When you're looking at passage of a bill, it's really important to consider who your sponsor will be, and I'll talk a little bit more about that as we go on, but keep that in mind that the bill sponsor is really important. So, how does a bill become a law? A bill may be introduced in the House or the Senate, and if it's introduced in the House, of course, the bill is sponsored by a representative. If it's introduced in the Senate, it's sponsored by a senator. Once the bill is sponsored and introduced into a chamber, it retains that notation as to where the bill originated. So it will have a number assigned to it, and if it's in the House, it will be a House bill or HB, and then it will have numbers attached to it. And if it's in the Senate, it will be Senate bill or SB with numbers. And those numbers are the order in which the bills are introduced. Usually, House Bill 1 and Senate Bill 1 are reserved for bills that either the Speaker of the House or the President of the Senate are supporting or pushing for passage. And the remainder of the bills are just numbered as they come in, as they're enacted or filed by legislators. Once the bill is introduced and filed and has a number, it goes to the Committee on Committees. And this committee is made up of leadership, in either the leadership in the House or the leadership in the Senate. And they decide which committee the bill will be assigned to. And this is another crucial step in the process. If your bill is assigned to a committee that doesn't support the bill, then your bill is probably dead. And I'll give you some examples of that here in a minute. But anyways, the Committee on Committees assigns the bill to whichever committee is going to initially hear the bill. Once the bill gets to a committee, the chairperson of that committee decides whether or not the bill is going to be heard in the committee. So again, another place for a stumbling block. And just to give you an example, the APR bill for removal of the prescribing agreement for non-scheduled drugs in 2012 and 2013 was assigned to the Senate Judiciary Committee. And the chairperson, the chairman of the Senate Judiciary Committee, Senator Schickel, did not support that bill. There was strong opposition in his district. He was close friends with some positions in his district, and therefore he wouldn't call the bill. No matter how much we coaxed, no matter how many people we sent to him, he wouldn't call the bill. As trying to go around it, we attached our bill language to a House bill, which we knew would pass in the House, which it did, but once it went back to the Senate and the Committee on Committees assigned the bill to a committee, they again assigned it to Senator Schickel's committee, and he wouldn't hear the bill. So that gives you an example of how powerful these committee chairmen are, and why legislators vie for chairmanship of some of these crucial committees. If the bill is heard in the committee, then the committee debates the bill, and they can either approve it or defeat it. If they defeat the bill, again, the bill is dead. Now, you can, again, try to go around it. If there's still time left in the legislative session, you can try and file a bill in another chamber, but chances are, even if it passes out of that chamber, when it goes back to the first chamber, it will be assigned to that committee, and chances are it will not pass in that committee. So you've got to think about all of these things when you're looking at a bill and where that bill is going to be assigned. You need to work behind the scenes, trying to get your bill assigned to favorable committees. Once the bill is passed out of the committee, it's sent to the floor of the chamber, and it must have 3 readings in that chamber in order to be voted on. And when I say readings, it means that it needs to be announced in that chamber 3 times. So, and that'll be on 3 different days. So the bill will get its first 2 readings, generally, not always, generally, and then it goes to the Rules Committee. And the Rules Committee is made up, again, of leadership in whichever chamber the bill happens to be in. The Rules Committee can decide to allow the bill to come forward for another reading and then a vote, or it could send the bill back to another committee. When this happens, when it sends the bill back to another committee, chances are that bill isn't going to pass. Frequently, the bill will be sent to the Appropriations Committee for, I don't know why they picked that committee, but the Appropriations Committee is a committee that looks at expenses. And so they'll say, well, we've got to see what the financial impact of this bill will be. And so they send it to the Appropriations Committee. And if that happens, usually the bill is dead. It won't go any further. Also, either the Speaker of the House or the President of the Senate, depending on what chamber the bill is in, can determine if they don't want the bill to be called for a third vote or a third reading, and in which case, again, the bill is dead. So you have several stumbling blocks where the bill can be stopped in the process. If the bill is voted on and passed, then it begins the process all over again. So if the bill is introduced in the House, and it's a House bill, and it passes through the committee, and it passes through the floor, and it's voted on and approved, then it goes to the Senate, and the process begins again. So again, the Committee on Committees in the Senate will decide where the bill will be assigned to which committee, and it doesn't necessarily have to be assigned to the same committee as it was in the House. But the bill will retain the same numbers. So if it's a House bill, even though it's in the Senate, it will still be HB and whatever number the bill is. So again, we have all the same stumbling blocks. If the bill is assigned to an unfavorable committee, and again, giving an example of Senate Bill 7 that just passed, when in 2013, the bill was heard in the House, in the Health and Welfare Committee, and passed, but then when it got to the Senate, it was assigned to the Judiciary Committee, which was unfavorable. So the bill doesn't have to go to the same committee in each chamber. It just depends on which committee the Committee on Committees decides to send the bill to. There has to be some rationale for sending it to that committee, but they can usually find whatever rationale they want to. Of course, they wouldn't send the nursing bill to the Agriculture Committee, but they could send it to licensing and occupations. They could send it to Health and Welfare. They could send it to Judiciary. So there's an array of options where they can send a bill. Okay, so we'll say that the bill has passed the House. It's gone through the Senate, it's gone through the committee, it's had its 3 readings on the floor of the Senate, and it's passed out of the Senate, and now it's going to the governor. Oh, I left out one step here. Concurrence. Concurrence means that a bill has passed out of one chamber, gone to a second chamber, and that chamber changes something in the bill. It could be one word, and I'm going to give you an example of that shortly. But once that happens, if the bill is changed in any way, then it has to go back to the original chamber and the original chamber has to approve that change in order for the bill to go to the governor. And the other chamber can decline to accept the change and send it back. And then the second chamber that made the amendment would have to make a decision on whether they're going to remove their amendment or if they're going to stick to it. If they decide to stick to it, then what possibly can happen is that the leadership in the House and the leadership in the Senate appoint a conference committee made up of whoever leadership decides it will be on that committee, and they hammer out a compromise. And then that compromise is brought forward to both chambers to vote on, and they can vote up or down on whether or not they're going to pass that bill. But let's assume that the bill does pass out of both chambers and it goes to the governor. The governor has options. The governor can sign the bill because he or she likes it, or not sign the bill. If the governor doesn't sign the bill will become a law. So there's two ways that the bill can become a law. The governor signs it or the governor doesn't sign it. Or the third option is that the governor can veto it. If the governor vetoes a bill, then the bill must go back to the House and the Senate, and it must pass each chamber by a majority vote. And if it does that, then it will become a law. If it doesn't pass in both chambers after it's been vetoed, then it does not become law, and the bill is done. So you can see that there are lots of ways to kill a bill, and it's really, really hard to get a bill passed. So I don't know if you can see that picture really well, but that bill is that picture is Governor Partin signing the APRN Prescriptive Authority Bill in 1996. And some of you might recognize some of the people in that picture. Kind of was a walk down memory lane for me, looking at some of those people from almost 20 years ago. But it's kind of a great picture, fun picture to look at. But why I'm showing it to you is because I would like to talk to you about how that bill progressed through the legislature, and that will kind of give you an idea of what happens with legislation. So, that bill was filed by Representative Mary Lou Marzian, who is a nurse. I don't know if you all know her, but she's wonderful. She had been a representative for just 2 years when she filed that bill. We had done a lot of homework beforehand, trying to work for support behind the scenes. And so the bill was filed in 1996 as a House bill, and was assigned to the Health and Welfare Committee in the House, passed out of that committee easily, went to the floor of the House, passed out of the House easily, went to the Senate. The Senate was not quite as supportive. There were a lot of senators who were supportive, but there were some in power who were not. And so when the bill went to committee in the Senate, there was a senator who changed one word in the bill. The wording was that APRNs would be able to prescribe non-scheduled drugs with a collaborative prescribing agreement. And he added the word legend in front of drugs. And so the bill passed out of the committee with his amendment, went to the Senate floor, and on the Senate floor, Senator Benny Ray Bailey from Eastern Kentucky did not like the bill at all. And so he filed 38 amendments to the bill, which can happen with legislation. Any legislator can file an amendment to a bill. And that was a really scary time, because the amendments that he filed, if any one of them would have passed, it would have made practice for APRNs in Kentucky very, very difficult. And if all of them had passed, APRNs would not be practicing in Kentucky. So it was a pretty scary time. We did a lot of lobbying and a lot of talking with Senate leadership, with House leadership, with senators trying to get Senator Bailey to remove his amendments. And finally, they had a caucus meeting. Senator Bailey was a Democrat, so the Democratic caucus met, and leadership of the Senate, for whatever happens behind closed doors. I mean, to this day, nobody knows exactly what happens behind closed doors, but pretty much they told Senator Bailey that he had to withdraw his amendments. And so he came back out on the Senate floor after the meeting and he withdrew his amendments, which allowed the bill to pass. The bill passed well out of the Senate, but it had changed in the Senate, so it had to go back to the House for concurrence. And here's where politics again comes into play. Senator Bailey and Representative Stumbo, who at that time was the majority leader in the House, were good friends. And so even though Representative Stumbo voted in support of the bill when it passed out of the House, he now had Senator Bailey coming back to him saying, don't call that bill for concurrence. We don't want the bill to pass. And so that put Representative Stumbo in a difficult position. And I guess I should backtrack a little bit and say that the majority leader in the chamber is the one who calls the bills. Now they can take direction from the Speaker of the House or the Senate President, depending on what chamber it is, but they have great leeway in which bills are called. And so in this case, it was up to Representative Stumbo to call the bill up for concurrence for a vote. And Senator Bailey did not want him to do that and lobbied hard for it. So I can still remember on the last day of the legislative session, sitting up in the galley, watching down below all of the representatives, and Representative Marzian on the floor of the House going to all of the representatives and telling them to go and talk to Representative Stumbo. I mean, we could see her down there pointing, you know, and she'd take him by the shirt and she'd go like that. And she'd be telling him, go talk to him, tell him you want to vote on the bill. And we could see him walking over to Representative Stumbo and talking to him. Finally, in the last hour of the last day, he called the vote, and the bill passed. So it gives me chills still thinking about it. But it gives you an idea of how politics comes into play and how much one person can affect a bill. So anyways, the bill passed in 1996, and APRNs began prescribing unscheduled legend drugs. So what is the goal of legislation? For nursing, I think these are the key factors. We want to improve access to care. We want to improve patient care, and we think about patient safety. I think these are universal for nursing, and these are the things that we always think about when we think about nursing. And the reason that these things are important is because these are the key points that we always talk to legislators about. Nurses improve patient care. Nurses improve safety. Nurses improve access to care. And they hear those things, and those things are important to them too. So that's why we focus on these issues, and I think that these things are the essence of who we are. This is what nurses are about and what we've always been about. So when you're looking to file a bill, you have the idea, you see a problem, you want to move forward. You have to have a strong concept of what is to be achieved, and what is acceptable to you. And when I say you, it's a collective you. And these things have to be determined early on in the process, before you even go to speak with a legislator and determine what the bill is going to actually say. You have to determine what is acceptable and what you want to achieve. So again, looking at APRN legislation, one of the things that we said was not acceptable was physician supervision. APRNs never have practiced under physician supervision in Kentucky, And in order for that to happen, if that were to happen, that would be a big step backwards. That would be going back, way, way back, past when the Nurse Practice Act was revised in the 80s, I think, early 80s, I think it was. So that was one thing that we said was not acceptable. We would take no bill rather than take that. And then we had to think about what was to be achieved. So I'll fast forward a little bit to 2003 or 4 or 5 or 6 when we were working on legislation for prescribing scheduled drugs. And again, bottom line, no supervisory language. We wouldn't accept that in 96, and we wouldn't accept that in 2006. We also said that we would accept some kind of compromise in the schedules that could be prescribed or the amount of a particular medicine that could be prescribed. So those were things we were willing to compromise on. So we had a strong concept of what we would accept and what we would not accept. And everything else was kind of open. And we determined that early on before we talked with the bill sponsor, so that the bill sponsor would be aware of what our bottom lines were. When you're choosing a bill sponsor, you need to find a sponsor who believes in your cause. Now, we knew that Mary Lou believed in our cause, and she's always believed in our cause, but there's also political considerations. And those things are, right now, the reality is that the House is democratically controlled and the Senate is controlled by the Republicans. And Representative Marzian is a Democrat, and she's a very liberal Democrat. And so any of her bills that go over to the Senate are scrutinized very closely. And if they have any hint, I'll say it again, hint of liberalism in them, they won't pass in the Senate. And so she recognizes that. And so she will a lot of times work behind the scenes to help us because she has friends in the Senate, and even she has conservative friends in the Senate. They wouldn't say that publicly, but they say behind the scenes that we're friends with Mary Lou. So we have to realize that the political reality is that to have a bill sponsored for something as controversial as prescriptive authority for APRNs, sponsored by Representative Marzian with a Republican Senate. And again, in 96, the Senate was Democrat, so it wasn't such a big issue. But now it is. So we have to think about that. And I guess I'm giving you an idea about the political considerations because you have to choose a sponsor who is going to be acceptable to both parties because the bill is going to be scrutinized by Democrats in the House and Republicans in the Senate. You also have to think about which legislators are friends with other legislators in the other chamber, because that can have a big impact. If there is somebody, for instance, going back to 96, there was a senator who was close friends with the representative, and he had a lot of influence in the House because of that. There are also people who owe other legislators something. For instance, they vote for a bill because a particular legislator asked them to vote for that bill, and then when it comes time for the favor to be returned, the favor may be not to support my bill, but to oppose a particular bill. You also have to think about stakeholders. Who are they? In nursing's case, KNA, KCNPNM, KNCC, KBN, AARP. AARP has come out in a big way in support of nursing in recent years, and so that's important for you all to note. The public, the people we take care of, Those are our stakeholders in whatever we do, physicians, pharmacists, and other healthcare providers. So depending on what the issue is, some of these stakeholders may be more prominent than others. But for the most part, the nursing organizations are fairly consistent as stakeholders. And when you talk about stakeholders, it's not always the people who are in support of your issue, but also those who are in opposition to your issue. So all of those people are stakeholders. And you have to consider what their issues are and why they might support or why they might oppose your bill. When you're looking at the legislation and the legislators, you want to know who supports the bill, who opposes the bill, is there a political divide in that support? And then you need to know the reasons why they support or oppose. So when you're talking to the legislators, they're going to want to know who supports the bill. And they'll ask you right out, they'll say, does Senator Stivers support this bill? Does whoever, they'll ask you, whichever senators they think might be important, they'll ask you about the committee chairs, they'll ask you about members of the committee where the bill might be assigned or is assigned, and then they'll ask you who opposes the bill. They'll want to know which legislators are opposing the bill, because they want to know if the legislators who are supporting the bill are powerful, or if they're friends, or if they're enemies. Sometimes if they're enemies, that makes them support you all the more. So you have to take into consideration all of those kinds of political things. And then is there a political divide in the support? In our case, there was somewhat of, and still is, on nursing issues, a political divide, because the House is Democratic and more liberal, and the Senate is Republican and more conservative. And so if you have a bill in the House that passes out of the House that, say, is looking more at social issues, looking at improving lifestyles or something of that sort, and it comes to the more conservative Republican Senate, they're going to want to know how much it costs, because that is one of the focuses of the Republican Party. They're into conserving financial funds, and so they want to know how much something's going to cost. And even if it's a wonderful issue, if it's going to cost a lot of money, they may not support it. So you have to think about those ideological political divides when you're bringing your bill forward. And you need to have that information at the ready, because they're going to ask you about that. They're going to want to know, is this going to cost anything when you get over to the Republican side? And when you get over to the Democratic side, they're going to want to know how many people it's going to help. And maybe they don't care how much it's going to cost. And so, those issues, I'm sure you all are aware of those issues and the constant fight that takes place between the two parties. And we all know that we have to find a happy medium, because if you can't pay for something, then you can't have it. But then again, sometimes you have to look for the greater good of the people and find a way to come up with the money. But that's another discussion, isn't it? So, anyways, they're going to want to know who supports it, who opposes, and what their reasons are. And you need to be honest. You need to be straightforward. You need to say, in our case, they would say, who's opposing? Well, we would say, well, KMA, the medical society, is opposing. And they want to know, well, why are they opposing it? And we say, well, what they're going to tell you is they're going to say that nurse practitioners aren't safe. And that's their message. We're not safe. But I'm here to tell you that that message is not correct. And this is why. And so you need to be honest and say what they're going to say, no matter how much it hurts your heart to have to say whatever it is that the opposition is saying. You have to be honest about it, but then you can come back and say why that's not correct. And they'll give you the opposition most of the time to say that. You need to have effective messaging. The message needs to be simple and easy to understand. You need to have talking points, and those talking points need to be pretty consistent. And again, it goes back to what I was talking about with the messaging, you know, safety, patient access, improved care. That's our message. And that's the basis for everything that we do, and that's the basis of what we couch our issues in. So when we're talking about prescribing, for instance, with Senate Bill 7, we were talking about 50 years of study showing that APRNs provide quality care that is safe, and in some cases, patients receive it better than care from physicians. We could tell them that it would improve access to care because more APRNs would open practices out in underserved areas. We had data to show that there were APRNs already in underserved areas, so we could tell them that they will go. There's some there now, and more will go if you pass this legislation. And we could say that this will improve patient care because patients will have more access to care, and therefore they will eventually be healthier. And again, as I'm saying, we couched it all in those principles, but those were the issues: improved access to care, nurse practitioners are safe, and we're looking at patient safety. Patience and persistence. It took 9 years to get the first APRN prescribing authority bill passed. It took 3 years to get the prescriptive authority for scheduled drugs, and it took 5 years to get the collaborative agreement for prescribing non-scheduled drugs removed. And that was a compromise because APRNs still have to keep Kappa NS for 4 years initially, and after 4 years then they're not required to have one, and they can practice and prescribe independently. So the compromise was there that, okay, the agreement will remain in place for 4 years. But it was, again, when we were talking about our basic principles, that was within that realm. We could live with that. We couldn't live with some of the other things that were brought forward, like putting nursing under the Board of Medicine. That was strongly supported by those we had to negotiate with. Let's see, what was another one? 8 years to keep the collaborative agreement, and only then could it be removed if that APRN was under the Board of Medicine and worked in the same office with a physician. So it was kind of like, no, that doesn't work for us. So, you know, we stuck to our guns, we made some compromises, and we got a bill passed. We'll have to see how that goes. You know, we may be back because the 4-year thing doesn't work. I don't know if you all are aware of some of the background, but the collaborative prescribing agreement only covers prescriptive authority. It doesn't cover practice. And it's an agreement that's signed by an APRN and a physician that says that the APRN can prescribe non-scheduled drugs. And that's all it is. That's it, period. There's no requirement for observation or review of charts or practicing at the same site, nothing. It's basically a piece of paper. And physicians were, and probably still are, charging anywhere from $0 to sign that paper to $5,000 a month. And if you can imagine what that does to the bottom line of a practice, paying $5,000 a month to have that piece of paper signed so that you can prescribe medicine, and being under the threat of having that agreement jerked out from you at any moment for no reason at all, or for sometimes good reasons, if, you know, if the physician dies or moves or something. But that threat was there, and so that was one of the pushes to get the agreement removed. But it took 5 years, and so we had to be patient, we had to be polite, always be polite. People can sometimes say rude or crazy things to you, And you have to be polite and just say, yes, or yes, sir, or whatever, and smile and walk away and figure out how you're going to respond to that later. So patience, persistence, politeness. I should have added that other keyword there. We'll get you success in the end. They get tired of you coming back. Finally, in 2013, the President of the Senate, a bill almost passed in 2013, the President of the Senate told the physician groups that they were tired of the issue, that they needed to come to an agreement with the APRNs, and that if they didn't, that they were going to pass the bill that the APRNs wanted in the first place. We were kind of hoping that they wouldn't negotiate with us because we kind of liked our first bill. But anyways, they did come to the table and they did negotiate, and we got a bill passed. So that's where the persistence part comes in. You know, we were straightforward, we were honest, they got it, they really got our point, but there was so much political pushback because, well, for one, physicians are big donators to political campaigns, you know. So if you've got somebody providing a lot of money for your reelection, you don't really want to vote for a bill that they oppose. And that's just kind of the reality of things. So anyways, persistence paid off and the bill passed. So, looking at all of that and looking at all the things that you need to do in order to get a bill passed, the other piece that has to be there is unity. And I can't stress enough how important that is. The more people you have speaking up in favor of a bill, the greater likelihood of success. Nursing, we don't do that so well. I've written down this number because I looked this up last night to see how many nurses there were in Kentucky. There are 81,703 nurses in Kentucky, RNs. There are 2,945 LPNs. And out of those RNs, there are 5,663 APRNs. That's a lot of nurses, but we don't speak together. We sometimes do, and when we do, our voice is heard, but we don't do it very often. And I would like to really stress to you all to go out and talk to your colleagues and tell them how important it is. Let them know how many of us there are. 81,000, that's a lot of voices. And that is a lot of people who can have an impact. If we all spoke up, that's a lot of votes. And that's basically the bottom line that the legislators are looking at. You know, if you have a lot of constituents telling you that they support a particular bill, then they're going to listen. And there's 81,000 of us, plus, and that's a lot of voices. And so we need to speak with one voice, and that's the name of this convention, one voice. And I think that that is a really important message for all of us to take away with this. And now I'm going to try and get you roused up a little bit about some issues. And there are a lot of other issues, but here are three. Board of Nursing fund transfers. Are you all aware of that, about the money that the state has taken from the Board of Nursing? As he's on the heads nodding yes?
Yes.
Last year, the state took $1.5 million from the Board of Nursing. That's a lot of money. And you say, well, how did the Board of Nursing have $1.5 million extra for the state to take? Well, I'll tell you how they had that money. It's because even though the Board of Nursing is an independent agency and it's run solely on the money that they receive from the licensure fees that we pay, because of the way the laws are set up and because it's an agency under the state government, the state can tell the board when they can spend money and when they can't. And so basically what the state did was told the Board of Nursing they had to cut staff, they had to have furlough days, they couldn't spend money, and eventually there was $1.5 million accumulated there because the state would not let the board spend the money on things that they needed to spend the money on. And then the state swept the funds from the board. And that's what they did with not just the nursing board, but other boards. It's just that the nursing board had more money than some of the other agencies. To add insult to injury, the plumbers board and a few other boards, and I don't recall who the other ones were. Nursing was not part of the lawsuit, but they brought a lawsuit against the state. And the judge in that case determined that, yes, the state could take those funds from the agencies. So it further handicaps us in this fight. But there's 81,000 plus of us. And if we speak up, our legislators will listen. There is some listening now, but not enough. Because in Kentucky, the Constitution requires the state to have a balanced budget. And so the state will do whatever the state needs to do in order to balance that budget. If you read in the Acadian Connection, the last issue that came out, Paula Schenck, who's the executive director, wrote some more about this issue. Was talking about how much more that the board is going to be required to pay for pensions in the coming year. And the board doesn't have the money now because the funds have been swept out. So we're talking over $500,000 that the board has to pay for pensions. So because that money's not there now, there may be an increase in licensure fees coming up in 2 years. So something to think about, something to raise your voice in a polite and persistent way, right? Because if you get mad and you talk loud and you say exactly what's on your mind, they're not going to listen. So you have to figure out a way to say it in a nice, polite way we need to stop doing that, right? Okay, another issue. Allowing nurses to practice to the full extent of their scope and education. And this is important for all of us. You know, we are educated professionals, and we know what we're doing. You know, we provide excellent care. Studies after studies after studies show that nurses provide excellent care. And we're needed, you know. We are there with the patients. We know what's going on with the patients. But that isn't always taken into consideration. So we need to look at the 2010 Institute of Medicine report that called for nurses practicing to the full extent of their education and training, and called for nurses to be full partners in redesigning healthcare in the United States. And that's happening, but it needs to happen more. Nurses need to step up. They need to join boards or try to get appointed to boards. They need to be on insurance panels. They need to make their voice heard because our voice is unique and we have an important issue to bring forward and we need to be heard. But that will only happen if we step up and make those voices heard. And then one other issue that I might tell you about is Medicaid reimbursement. And probably many of you aren't aware of how much Medicaid pays APRNs for providing care, but it's not much, and that needs to improve. APRNs are paid 75% of the physician rate for a visit, and when you're looking at visits in primary care or in specialty care too, they use the same levels. A level 1 would be sort of like a patient comes in to get an injection or a dressing change or something, and the provider doesn't need to see them. Level 2 is a patient comes in and they have high blood pressure, and the blood pressure is well controlled. Maybe they have high cholesterol and it's well controlled too. Level 3 would be they have high blood pressure, they have diabetes, and maybe their sugar's running a little bit high. Level 4 would be they have high blood pressure, diabetes, COPD. Not too many people like that Medicaid only allows you 2 level 4 visits in a year. Doesn't matter if you see that patient every month because they've got uncontrolled diabetes or their blood pressure is bouncing all over the place. Doesn't matter. 2 level 4 visits a year, period. So you can't ethically say, well, I'm only going to see you every 6 months because that's all I'm going to get paid for. You don't do that. We're nurses, right? We don't do that. We see them every month if we have to. We see them every 2 weeks if we have to. We see them every week if we have to. But we can't bill for it if we see them. So, that's another issue. And that is both a legislative and a regulatory issue. Because the fees are set in regulation, but the legislature has to appropriate the money. So again, it gets a little bit complicated because we got to get the legislation passed in order to appropriate more money to pay APRNs more. And you know, frankly, at this point, I think APRNs would be happy with being paid the same rate as physicians. But again, we only get paid 75% of what a physician gets paid for seeing the same type of person, patient, or treating the same problem. You know, if you have an earache, you get a amoxicillin, whether if you're a nurse practitioner or a physician treating the patient. It's the same thing. But the APRN will be paid only 75%. So I'm going to leave you with that. Some food for thought. I know that there are a lot of other issues, but I didn't think that we would have time to go into all of those things. But I just wanted to give you an idea of some of the issues that are out there that are important for us to stick together and speak with one voice and advocate for change. And again, there's a picture for Senate Bill 7 passing. We're standing there smiling with the governor, being very happy. Any questions? Yes.
Beth, could you comment on the value of having a strong lobbyist and getting your legislation passed?
Absolutely, absolutely. And that's something I didn't say, but that is something that's very important. The coalition, as everybody calls it, it's the KCN-PNM, has 2 lobbyists. Actually, we have Sheila Schuster, who is our longtime lobbyist, and then McCarthy Group, which is run by John McCarthy. He has several lobbyists in his firm lobbying for us. And so that opens a lot of doors for you. It gets you in places where you couldn't get by yourself because there are no people. And also because both of those groups, and when you're looking for a lobbyist, you have to look for somebody who is respected on both sides of the aisle, both Democrats and Republicans, respect them, who are known for being truthful, and again, this is, in my opinion, there are some lobbyists out there who maybe are not as truthful as others. But that's an issue that's important to us. You know, whenever you're, and that's one of the things that nursing is known for. If we're nothing else, we are honest. So if a legislator asks you a question, they know that they're going to get a straight, honest answer from a nurse. And our lobbyists are the same way. But yes, that is very, very important. And it's not cheap. Anything else? Yes?
In terms of messaging, when you're trying to get a number of nurses to go to their legislators with why this bill is important, do you suggest a maximum number of points be made? Because I've seen a lot of information, and it's almost like the more you give, the less that gets absorbed. So do you have any thoughts on that?
Yes, absolutely. Kathy was saying, is there advantage for having either lots of points or a few points? The thing that we have found to be most effective is to pick about 3 points that are really, really important and have those kind of written. You always give them paper, and you always leave something there with them, and you always send a follow-up letter thanking them for talking with you. And you make your points, and you try to bring it down to the bare essentials. But then you also leave other paper with more points. on it, so if they want to read further into the issue, and some do, you know, some have asked us for more information. And others, you know, just want to look at that one paper that has the 3 points on it in the big letters. And so you do both. But when you're talking to them, you hit the high points. If they ask you questions, then you elaborate. If they don't ask you questions, then you don't always elaborate. But yeah, you need to bring your message down to just a couple, 3 at the most points.
Any other questions?
I want to make a comment. Do you want me to stand up or do you want me to sit? If you don't watch any political programs or anything about politics in Kentucky, there's one that you should watch, and it comes on every week on KET, and it is Comment on Kentucky. And they mention this very issue about nursing. They use nursing as an example. The people that are on that program or appear on that program, they've had various moderators, and for whatever reason, some of them get old and retire or whatever like that, but it's people like from various television stations or from the Kentucky, the Herald Leader or the Courier Journal, maybe Janet Patton, who is now who does various things in the Herald Leader, so they have a little, depending on what their topic is about, but they talked about this very thing about the governor taking the money from the general fund, and nursing was used as an example. Comes on Friday evenings on KET, either 8 or 8:30, and it is repeated on Sundays about 12 or 12:30, so it depends on how long church lasts, so if you can see it on Sundays. Or you can record. Yes.
And any other question or comments? Thank you so much.
Thank you.